Scenes like this were common in Myanmar until Wednesday. Crowds of people used to wait for hours to get oxygen for a loved one suffering from COVID-19.
People are worried and scared. There's also been pressure from the military telling people not to queue for oxygen.
The junta has now imposed a new rule. People will need a letter from their local administrator to obtain oxygen. Like much of Southeast Asia, Myanmar is experiencing its worst wave of coronavirus infections. Its healthcare system, ravaged by decades of military dictatorship, is struggling to cope. The coup in January and the subsequent crackdown on medical professionals for being one of the first groups to go on strike is turning an already dangerous health crisis more deadly.
The military are closing down charity clinics and arresting doctors who volunteer there. They pretend to be patients and arrest doctors. That's why doctors are on the run and in hiding.
The junta has denied carrying out such operations. This doctor, who wants to keep his identity secret, says he and his colleagues have had to resort to using their phones to give consultations. He estimates at least 70% of his patients have tested positive for coronavirus.
Hospitals are not accepting patients. I've heard of soldiers pointing their guns at patients and telling them to go home. They should not be the ones deciding who gets admitted to hospital.
Some patients are also reluctant to go to government health centres, citing a distrust of military-run facilities. Many end up self-isolating at home. In Yangon, residents hang out yellow flags to show they need medical supplies, hoping volunteers will help. The number of people dying in their homes is increasing.
Ambulance services normally take patients to hospitals, but these days there are more requests to pick up bodies.
Funeral services are overloaded. Some families have had to wait several days before a body can be transported. As coronavirus infections and deaths soar, the UN independent expert on human rights in Myanmar, Tom Andrews, has called for a COVID ceasefire, urging the international community to pressure the junta to stop its attacks on healthcare workers so they can do what they are meant to do, deliver medical care. Florence, Looi, Aljazeera.